The government's proposals for a national care service are based upon the findings of an independent review of adult social care that was completed in February this year, and is led by Derek Feely. So it's sometimes known as the Feely report. You might have heard of this. And that review said that there was a lot of good stuff about the current system for social care, but also found some problems with people's experience of that. So a gap between the intentions, the good intentions of providing social care, and what actually happens on the ground for people. And that review made a number of very detailed recommendations about how to tackle that gap, and the Scottish Government has since committed to implementing those. The consultation that's live at the moment sets out how the government proposes to do that. Oops, sorry. They're consulting, well, the original review of adult social care, as the name suggests, was restricted to just adult social care. The Scottish Government's proposals now go significantly beyond that. They view this as a collaborative cross-government opportunity to really transform social care. And it goes beyond adult care into, for example, child services as well. In the Scottish Government's manifesto this year, before the election, they committed to create the National Care Service backed by an increasing investment by 25%, and committed to starting the formal consultation on legislation. And the intention being to bring that legislation before Parliament during the first year, so by next summer. The creation of a National Care Service is going to mean that Scottish ministers, for the first time, being accountable for national standards of community health and social care, with strong local accountability retained through delivery structures. So the government recognises social care is an investment in a society. It's not just a burden. It should be about enabling people's rights and capabilities. And the Feely report talks about a care service being a springboard, not just a safety net for people's needs. Social care should be about putting people at the centre of what they need and enabling them to live independently, not just about people slotting into the services which are available to them. In Scotland, there's been a commitment to integration locally and nationally. Of course, we've already got the integration nominally of health and social care. And the aim of that 5 years ago, I think it was when the legislation was first brought forward, was to shift the centre of care towards the community, towards prevention, and to reduce the burden on hospital services. And there's been a lot of progress made, but that's not universal across Scotland. Increasing the spending on social care and making that more effective, the government sees as an investment to benefit all of Scotland, and to try and remove some of the inconsistency in the levels of care that people receive currently. The consultation period runs until 2nd of November. The proposals include how to develop a community health and social care system that empowers people to thrive, to do more than just survive. It covers how to ensure everyone who needs it can expect the same standards of care wherever they are in Scotland. It recognises that community health and social care is an investment. It enables people to participate fully in society and the economy. It covers the scope and the reach of the National Care Service, links with community healthcare services, which at the moment are delegated to integration joint boards. It talks about improving how care is planned and delivered in practice, including rights to breaks from caring, which I mentioned before, and non-residential care charges. There'll be a move to ethical commissioning of care across Scotland. The consultation covers the regulation and scrutiny landscape, and also how best to value and support the people who work in social care. So the government has proposed to establish a comprehensive community health and social care service for all ages, so not just adults, but children as well. So it includes children's services, social work in prisons, alcohol and drug rehabilitation, and alignment with justice social work. The government wants to transform the way that care is planned and commissioned and procured So there's collaboration between services, not competition. They want to establish partnerships and planning, commissioning and procurement processes, and embed fair work and a person-centred approach. In terms of the way that people access and receive care, the government is proposing what they're describing as a getting it right for everyone approach. And that's based on the success of getting it right for every child approach, which has been in place in Scotland for some years now. And the idea is that support and services can cluster around individuals and families to ensure they get the best possible outcomes and their individual needs are met as well. Now, the concept behind that's very simple, as it says here, but delivery is very complicated because that involves changing the way things are done now. They want to make sure there's a no wrong door approach, which means that people should only have to ask for support once and are supported depending on their individual's needs. They want there to be a focus on support at all levels of people. They want there to be a single planning process linked to a single social care and health record to ensure that people's information can move through the system with them, but with their agreement and consent, of course. They're also proposing to strengthen regulation by setting out core principles and providing more powers to the regulators, particularly of the workforce and professional standards. And they want to strengthen the way that people can complain when their care falls below the standards they should expect. A national care service is going to set standards nationally, drive improvement across the system, and also make sure there's a national overview and, for the first time, national accountability for community health and social care, which will lie with the Scottish Government's ministers. And that's also going to allow for strategic integration with the National Health Service. And they want to have strong local accountability. So the government is proposing to reform the existing integration joint boards and to instead establish local delivery bodies, which will hold budgets, which will plan, commission and procure care in their own right, rather than doing that on behalf of local authorities and health boards as it is at present. The government thinks that people with lived experience need to be involved, which is great to hear. And so those people should sit on the boards, those local boards, along with locally elected members and professionals. And there is a question in the consultation asking about who else should be members of those boards and who should have voting rights as well, importantly. So a quote here from the Minister for Mental Wellbeing and Social Care, that's Kevin Stewart, MSP. He says it's right for this consultation to look beyond simply the creation of a national service for adult social care. The ambition of this government is to go much further and to create a comprehensive community health and social care service that supports people of all ages. So what are the government already doing? So there are existing activities already underway, not waiting for the National Care Service to be in place. The government's committed to implementing the review of adult social care recommendations, that FEDI report that we started with. Many of those recommendations themselves don't require legislation for the government to get cracking on them. They're also continuing to work on fair work for social care workforce through the Fair Work in Social Care group. And they are introducing a proactive and preventative care programme to ensure integrated support for people. Who does government want to hear from? The consultation is a very broad and open process. No decisions have yet been made. The future of community health and social care should be informed by people, and people that access support, people that work or are providing support, and people that support others to access services need to be involved. The government wants to hear your views. They've been running engagement events such as these. There's a link there to the National Care Service consultation mailbox, and we also have the link in the chat box to the consultation document itself on the Scottish Government website. So the commitment is for the National Care Service to be operational by the end of this Parliament. That takes us up to March 2026, so still 4.5 years away. The engagement and discussion about the detail of how the National Care Service will operate is going to run long beyond this initial consultation period, and the government has committed to deliver change together. So they want to hear, what do you think of the proposals? what things can be done better, and what do you think the government should be doing? So that is the end of Ingrid and Laura's presentation. Apologies to Ingrid and Laura if I haven't done it justice. I'm going to ask Emma and Joanne now they've been monitoring the chat box, see what questions there we could put to Ingrid and Laura.
Hi there, Kath. There's a question from Frederick van Wyk, who asks, with regard to slide 8, which covered the local delivery bodies, they seem crucial to the success of the initiative. Do we know who governs them? How they will relate to the local councils or the NHS? How are they funded? Who decides on funding priorities? So there's a good few questions to kick us off.
Laura, Ingrid, if you're able to type quickly any points you want to make there, please do in the chat box and we will highlight them. In the meantime, based on my understanding, Fred, the local delivery bodies, I think the intention is that they will largely match the local authority boundaries as the integration joint boards do at present. But there is a question in the consultation about people's views on that. I think our thinking is that there's a danger of too much overlap between the functions that all those different organisations will provide. Could what they do be delivered more efficiently by perhaps joining some of those up? In the Lothians, of course, for example, we've got 4 different health boards, 4 different IJBs within the health board area.
Catherine, I came prepared. A few people sent me questions in advance, but didn't want to be named. So the shy questions I can put to you, if that's okay.
Yes.
The first question that came from one of my colleagues is, how are you going to ensure that the development of the National Care Service is informed by people with lived experience?
Well, the Scottish Government consultation team have been proactively going out and speaking to a lot of people, I understand it, during the consultation phase. I think the challenge is this is such a big and complex proposal, and the consultation document itself is vast. It's 150 odd pages, maybe 90 or so questions that can be quite hard for people to digest. There is an easy read version now on the Scottish Government webpage, which is helpful, but it's still a very, very long document. As I understand it, the opportunity to input into Scottish Government development of the National Care Service isn't going to stop next week when the official consultation period ends. They see it very much as ongoing after that. What I don't know as yet is whether there'll still be opportunities for sessions such as this. I don't know if Ingrid has put anything in the... Yes, so Ingrid's put in the chat box, they've created a social covenant steering group with 20 individuals on it with lived and living experience of social care. Ingrid's going to share a link to that group so that we can see the membership of that. And Ingrid, it might be helpful to know as well how that group will operate. Can we feed direct to members of that? And Tom's asked, how does this impact on us as a charity? That's something we're looking at the moment, Tom. There are implications there for us. At the moment, we work with the existing integration joint boards. If those are going to be replaced by new health and social care boards, they'll become our partners. So we need to look at the implications of that. I think there's some good opportunities in there. We'd welcome seeing the membership of those boards, including voting rights for people with lived experience, for charities, for allied health professionals. At the moment, none of those have voting rights on the existing integration joint boards, which we think is a gap. But there's opportunity here to address that.
Kath, can you see Bill's question? Bill has put a question in the chat.
Yeah,
Will there be a 25% increase in investment? Sorry, where will it come from? Will it be at the expense of other services?
I think that's a question for Ingrid or Laura if they have a chance to come back on that. Just coming back on the lived experience, Ingrid's put that they are going to continue to engage with us all once ministers have made a decision on the way forward, and they're going to set up working groups as they develop policy, legislation and implementation. So we've got a wee bit of a time lag between the question and the response.
Christine's asking about mental health. Kath, I'm concerned for mental health and aware that in some areas services set up for mental health are increasingly being used to support other groups.
Okay, as I understand it, the new National Care Service will include mental health services, but Ingrid or Laura, correct me if I'm wrong there. Ingrid's come back on the funding issue. She suggested it will depend on what functions the National Care Service has, as funding will follow functions. So presumably once it's been determined exactly what the NCS will do, the funding decisions will be made at that stage. And we now have a link as well from Laura to that social covenant steering group, which is great.
Well, one of the people who uses our services, Catherine called Maddie, is asking if you could say a little bit more about what ethical commissioning means.
I'm going to quickly refer to my copy of the consultation document itself, which has a whole section on there. So the principle behind ethical commissioning is that it has a person-centered focus and puts human rights at its basis. That includes fair work practices, encouraging the development of a sustainable and a valued workforce. It takes into account climate issues, circular economy, financial transparency, and the full involvement of people with living experience throughout. So putting the person at the center of making the choice. And so ethical procurement will ensure that they'll be delivered to quality, right quality in a timely manner, but also that through procurement, they can meet those broader objectives around social, economic and environmental objectives as well. I hope that goes some way to answer your question.
The chat's filling up. There's quite a few questions there. Margaret's asking, how will the public be informed once a way forward has been decided? And how will the working groups be chosen?
Okay, I'll give Laura and Ingrid a moment to respond to that.
And Frederick is reasonably concerned that 25% won't be enough to ensure that the additional scope can properly be delivered. I think that's maybe a comment rather than a question.
Yeah, I think that's a fair point. I mean, the scale of the changes proposed is so vast, and obviously there are serious financial and economic issues at the moment, which we're struggling with, particularly the NHS. I can understand people's concerns about how this will be funded. Ingrid has said a financial memorandum is going to be published once the National Care Service scope has been settled, and all costs will be set out in there.
There's a question from Lizam as well. He or she, I'm sorry, Lizam, says, in Loch Arbor, many families are given care packages, but there's not enough care providers to provide the care. What will you do to make care jobs more inviting so recruiting staff can be easier? There's a second part. SDS option 1 is very difficult and stressful for families to take on. Are there plans to offer more support for people to be able to take on SDS option 1?
So Lisam's talking there about self-directed support. Again, we'll give Laura and Ingrid a moment to see if there's anything in there they want to come back on.
While you're waiting for Ingrid, Kath, I have a couple more from my colleagues.
Yeah.
One of them was wanting to know, is there going to be a national standard commissioning process with consistent national supporting documentation and guidance?
My understanding, yes, there will be development of new standards across the commissioning process.
I hope this is an easy one for you as well, Kath. Another one of my colleagues is asking, what are the plans to ensure that the third sector is meaningfully involved in the delivery of services?
That's a really important question, obviously, for us. And it's a challenge sometimes, I think, Emma, you'll agree, for charities like Chest Heart and Stroke Scotland to make sure that the help we can offer people is integrated to the package of care and support that people should receive, whether that's from the National Health Service or potentially from a new national care service. I don't know if there's anything else you want to add there, Emma. Emma, is there anything else you want to add about the challenges about service delivery for the third sector?
Yeah, but it's wrapped in with the commissioning process, and I think provided that we have clarity there and that there are national standards, that should make our involvement easier if there's a level playing field across the board. But being prepared to engage with the third sector and give them the status and the recognition as the public and the private sector providers, because we can provide the expertise and experience that others can't. So just including us all the way along, I think.
Yeah, and it's really encouraging to see in the government's proposals and in the Feely report a lot of mention about the importance of a more informal community-based support, which charities like ourselves have got a lot of experience in, and is still a really important part of the help that people need. So I guess the challenge for the government is to how they're going to make that a reality on the ground.
One of your first few polls was really significant in that respect, because people are interested in things that make their lives better. It's not the medicalized nitty-gritty stuff necessarily. It's the community-based support that we provide to improve people's lives and help them live their best lives.
Absolutely, yeah. A couple of responses from Ingrid here regarding care providers. Her policy colleagues in government who are working on workforce issues are looking at the options to make working in social care a great place to work. And that's happening right now as part of the Fair Work and increased pay as part of valuing the workforce as well. So that's all very encouraging. And again, with the third sector, it's vital that we have an equal opportunity to deliver the services that we do to support people. There's another question from Fred there. Do we know if the standard of care will be linked to standards of staff education, training and experience? Given the challenges many care providers face, a plan for workforce development is likely to be important to ensure the required level of care can be delivered. Will workforce training and development be included in the plan? My understanding, I think it probably will, but again, I'll defer to Ingrid and Laura for their expertise on that. In the meantime, Emma, are there any other issues or points that you have that colleagues have probably raised with you?
Yeah, there's one here that's maybe slightly more controversial. Somebody says the plans for the reformed integrated joint boards with local delivery may seek to only add another layer of bureaucracy and cost. What's the thinking behind that?
I suspect much of the thinking behind that is not losing the expertise that the existing boards have built up, albeit with some limitations, and presumably by, rather than completely reinventing the wheel, but expanding the scope to social care and health, they won't lose that expertise. But yes, very important not to introduce extra layers of bureaucracy, which could further slow things down. And we need as much expertise and leadership as possible, I'd suggest, to make this a success as well. And we don't want that to be spread too thinly across many different organisations.
There's a few comments about the cost coming up. Some people sharing Fred's skepticism that maybe there isn't going to be enough money in this, especially for councils. And is there a power grab going on there? There's comments around the extension beyond health and social care to mental health and children's services. Are they biting off more than they can chew?
I think that is a concern, isn't it? And I've seen some coverage in the media of local authorities' worries about that potentially being a power grab of the services they currently deliver.
Morag asked a good question in the chat here. Are there any other models in other countries where there's something similar to an NCS, or are we being unique in Scotland?
That's a really interesting question, actually, isn't it? Again, Ingrid and Laura can advise, and have they been looking to best practice elsewhere in the world that we can learn from? That'd be really interesting to hear about. And Bill's asked about how the government might avoid speculation they're moving towards privatising the service if an increasing number of external agencies are used to provide social care. I think at the moment, as I understand it, the majority of residential care is private anyway, and the creation of the National Care Service won't change that, but it will put in place structures around that to make it access to that fair and more accessible, particularly funding that. I'm not sure that the proposals themselves will necessarily lead to increased privatisation. But again, Laura, Ingrid can advise. On the point about integrated joint boards, Ingrid said they've got different services delegated. So some at the moment cover children and justice and some don't. So the government's intention is for there to be a clear approach across Scotland. So I guess wanting that consistency around what boards are responsible for and on a local basis. Have we got any other comments or questions coming up that we've not covered so far?
I'm just having a quick scan. I think we've picked them up. Just checking for hands as well.
Okay, I think given our technical problems, which has meant you've been doing an awful lot of listening to me, and based on my not expertise around the National Care Service, I suggest we bring this to a close a wee bit earlier than 1 o'clock, about 10 minutes earlier, so you get 10 minutes back of your day and a bit longer for lunch, hopefully. There's a comment from Ingrid, just encouraging everyone to respond to the consultation with your views. We don't need to respond to the whole consultation, which is a relief because it is a very, very long document. We can choose to answer just questions in chapters that are particularly relevant to you or of interest. So the link to that consultation I put in the chat at the beginning, but I will email it to everyone here today as well. So you've got that in your email box. I'll check with Ingrid whether it's okay to send over a copy of the slides as well. A quick question from Irene about care workers being able to give people medicine. I don't know if the proposals at the moment, Irene, go into that level of detail. I imagine that'll be something that's probably covered by the workforce planning bit of this, but probably an important issue you might want to raise if you do put in your own response to the consultation document. And Ingrid said, yes, I can share the slides with you. So that is great. So if nothing else pops up into the chat box, oh, thanks, Bill. That's great. I suggest we'll finish it there. As I say, I'll email everyone the links and the slides. Apologies for all the technical issues. I did warn at the beginning. It's the first time we've done a webinar on this scale, but hopefully you found it useful regardless. And thanks very much for your time today.